soon as we fix healthcare, we have to fix transportation. It took me an hour and a half to get here. Tuesday, I head back to Washington to fight for you, to fight for the public option. Healthcare for all. I come from a family of doctors. My father treated 3 generations of patients in West LA. Growing up, I was so proud of my father's work providing affordable, accessible, high-quality health care to everyone in the part of Culver City that he served. We're here to talk about reforming health care, but the thing is we can't talk about that without talking about outrage, without being outraged. I spent yesterday listening to doctors, hospital officials, and community clinic leaders in my congressional district. They told me of their experiences on the front line of health care. I know you've heard about them from all kinds of folks earlier this evening. Their stories make my heart break. Their stories make me outraged. I'm here today because, just like you, I'm outraged. It's an outrage that we have the most expensive healthcare system in the world, but we're not even close to having the highest quality healthcare system in the world. It's an outrage that Americans pay the highest prices in the world for prescription drugs. The same drugs that sell for a fraction of the cost in Canada. I think we should be able to import drugs from Canada, don't you? It's an outrage that insurance companies think it's okay to cancel individual health insurance policies when a customer who's paid premiums for years actually uses the coverage. Just last week, that happened to my 27-year-old son. And I'm sure it's happened to many of your family members, too. It's an outrage that 1 in 4 Angelenos between 18 and 64 have no health insurance. It's an outrage that millions of families face a choice between buying medicine and putting food on the table, between paying to see a doctor and paying the rent. It's an outrage that our system is so deficient that last month when the Remote Area Medical Corps, a group that was formed to provide medical care for people in poor rural areas, set up a clinic in the parking lot of the Forum, 12,000 people showed up. 12,000. Those of us who saw the footage on TV all had the same reaction. It looked like a refugee camp. Right here in the middle of Los Angeles. And you know what? In many respects, it was a refugee camp. For 12,000 people seeking refuge from a healthcare system that failed them. And where will their follow-up care come from? It's an outrage. Outrage. And it's, what? Outrage. That Sarah Palin, Glenn Beck, Rush Limbaugh, and even some members of Congress have resorted to outright falsehoods in an attempt to derail health care reform. Just plain despicable that they would treat terminally ill patients who want to make choices about the medical treatments they receive in the last years of their lives as pawns for their political agendas. Well, we're here today to turn outrage into action. Reforming this system is not an option. It's a necessity. The health and economic future of all Americans depends on it. So, to fix it, we need a health care bill that promotes competition, encourages innovation, preserves patients' choice, provides coverage for as many people as possible, and I don't see how we're going to do that unless we support and create a robust public option. Would be an outrage. So, when I return to Washington next Tuesday, that's what I'll be fighting for. It's